consultant physician at 2050 hospitals. On the occasion of World Pneumonia Day, we are here to talk about few frequently asked questions so that you have better awareness about pneumonia. Pneumonia is nothing but the infection of the lung tissues. So once the lungs are infected, the function of the lungs, which is oxygenation of the blood, does not take place. Hence, a patient feels breathless or the saturation drops. So that is why pneumonia becomes more important to understand. Pneumonia can be classified in different ways. The most common form is the hospital-acquired pneumonia or the community-acquired pneumonia. Community-acquired pneumonia is the pneumonia or the infection that we pick up from the community, say from the schools, from homes and stuff like that. Whereas the pneumonia that is picked up from hospitals, when we are hospitalized, when we pick it up from another patient, then that is called hospital-acquired pneumonia. Community acquired pneumonia usually are more easily treatable because the bugs which are causing the pneumonia are not multi-drug resistant, whereas the ones that we acquire from the hospital are more difficult to treat because of the bugs which are multi-drug resistant. There are other ways of classifying it, like the based on the portion of the lung that is affected, say the lobar pneumonia or the bronchopneumonia or the interstitial pneumonia. So lobar pneumonia is when the alveoli of the lungs are affected. Interstitial pneumonia is when the area between two alveoli are affected, and bronchopneumonia is when there is involvement of the windpipe or the smaller the smaller area is called as the bronchiole as well as the it is the younger population or the older population. So children less than 5 years of age and older people above greater than 65 years of age are more commonly to develop pneumonia. The younger generation, why? Because the immunity is not fully developed, and above 60 years because their immunity is on a decline. And also people with lung conditions like cystic fibrosis or those who have COPD are at more risk of developing pneumonia because portions of the lungs have already been affected, and an additional super stressor of infection always worsens their conditions. Age and conditions have already explained, and lifestyle, drinking and smoking. So smoking, as we all know, affects the lung conditions, and being in a heavily polluted area and not having a healthy lifestyles are definitely contributors for easily developing pneumonia. Fever, cough, breathlessness, heavy chest, stabbing chest pain are the most common symptoms of pneumonia. In younger children, they may not present with cough, but always an increased rate of respiration, say around 60 breaths per minute for kids less than 2 months of age. For those kids between 2 months to 1 year of age, a respiratory rate of greater than 50 is a red flag. And for those above between 1 to 5 years of age and any respiratory rate above 40 is a red flag. So cough, fever and higher respiratory rate and even indrawing of the lower ribs is also another sign that the kids can be having pneumonia. These are the common symptoms and signs to look out for. Sputum production. So if the kids are producing a lot of sputum, productive sputum, that also becomes an important thing to look out for. The first is the symptoms and signs that we look for, the clinical examination that is done, and pneumonia is then confirmed with the blood test. So one is the complete blood count we do, where we look out for the total count to see if it's an infection or if it is just an inflammation that is going on, followed by chest X-ray, ultrasound of the chest, CT, MRI if necessary, and sputum examination to find out which particular organism is causing and which would be the best antibiotic to act upon. So we usually start off by giving, antibiotics, then medications to reduce the inflammation of the lungs, oxygen support when required, and nebulizations. So this is the standard treatment. So based on whether like whether it is bronchopneumonia, whether steroids needs to be given more, or any or the antibiotics or the antiviral needs to be given, that can be done based on the confirmation of the type of pneumonia. So to start off with, it is always the healthy lifestyle that people must follow. Avoid smoking, avoid drinking, sleeping, getting a good rest of 8 hours of sleep. Then exercising, following a balanced diet is the main things to look out for. Now post COVID, all of us are aware of the preventive measures of sneezing or coughing into our elbow, then covering ourselves, wearing face masks when we ourselves have cold and cough, making sure we sanitize our hands frequently are the other simple things, basic things that each one of us can follow. The next more important step becomes vaccination of the younger population as well as the older population, which will give them immunity and protection against particular diseases. Vaccines are very important because they protect us from a particular microorganism. Say the Streptococcus pneumonia, Pneumovac gives us protection from Streptococcus pneumonia. Influenza vaccine protects us from the influenza virus. So most of the vaccines are already part of the immunization schedule, and the kids do get it before the age of 5 years. And kids who have asthma, kids who have lung problems, they need to be given influenza vaccine just before an epidemic. So a new strain of virus or new strain of vaccine is always released in and around September, which is a good time for school going children to take in their annual influenza vaccine. We have been giving a lot of predominance to the vaccination for older generation as well. So people with diabetes, people with who are immunocompromised, people who have COPD, people who have lung disease are also encouraged to take streptococcus pneumonia as well as influenza vaccine according to the vaccine schedule. So roughly around 4% of the world population are affected with pneumonia annually, which is quite a big burden. And in developing countries, it is one of the major reasons for mortality as well. Hence, knowing about pneumonia, picking up sign, and taking the required medication or reaching out to the healthcare becomes very, very important to reduce the burden of the disease. The community should know what pneumonia is, when to seek help. Second thing is spreading awareness, isolating oneself when there is an active infection going on, and the basic hygiene measures that we have already explained, once followed, will be the best way to protect ourselves from pneumonia as a community. What happens is that pneumonia, like I have explained in the beginning, is the inflammation or the infection of the lung tissue. Once this tissue is damaged, then that portion of the lung will not help in oxygenation of the blood. And a person may have to put in extra effort to get the same amount of blood oxygenated when compared to a normal person. So yes, a person who has had a severe pneumonia, based on the amount of lung that is affected, they may have to have a minor changes in their lifestyle or what they can do on a regular basis, which can be guided by your healthcare worker. Maintaining lung health becomes very important so that no further tissue damage will happen. Patient can use spirometer, which can help in maintaining the lung capacity of the remaining lungs. Following a healthy diet, resting adequately, exercising regularly will also benefit.